Unplugged Stories of Dr. Satish Reddy.
So, welcome to the Unplugged Series. Today we have our guest, Dr. G. Satish Reddy. He is a runner, he's an orthopedic surgeon, and a sports medicine specialist. So, welcome to the show, sir. Dr. Satish, I follow your Instagram. Okay, I've seen your LinkedIn post and also your WhatsApp status. Okay, I must congratulate you for your recent New York marathon, and I also believe you did prior to that 6 months back you did Chicago marathon before New York marathon. You are a marathon runner, but most of us, we know you as an orthopedic surgeon. So what was the turning point when a surgeon become a marathon runner?
So in about 2017, had gone to school where I studied and tried to play basketball with the present generation of kids, and then realized how unfit we had grown over the years. And immediately after that, during a school meetup, we had all decided that we all should try to get back or regain our fitness. So instead of talking about losing weight, we were talking about becoming fitter again, and somebody coined the word fit by 50, and that's what made me start exercising again. And I started doing various things, and what caught my attention and what I started to enjoy was running. So, and I live very close by to KBR Park, and I started running every alternate day. And from running 5 kilometers to doing a full marathon, it was a natural progression because I really enjoyed running.
Interesting. Dr. Satish, I remember you had foot drop, and in spite of that, you went about completing a marathon, and I guess you underwent a surgery. In a normal scenario, I'd seen that people, they stop running, or probably their doctor might have asked to take a pause. In such case, what is your suggestion, and how did you went about completing a marathon? Is it because you're an orthopedic surgeon, you had an extra knowledge how to overperform? Okay, so can you give us some insight about it, what actually happened?
See, I had a foot drop because one of the discs in my spine had been pressing on the nerve. It's been a problem which I had for many years. But then suddenly your foot stopped functioning where you cannot actually lift up your foot. So I underwent a surgery. Yeah, I remember one of my surgeons, he came on rounds the first day. He said, when I asked him, when can I start running? He said, it'll be years. But when you're passionate about something, the basic fundamental idea of a doctor should be that he should be able to get me back on my feet and allow me to do what I was already doing. That should be the goal of any orthopedic surgeon or the goal of any doctor, that you try to get the person back to his pre-injury levels. So even though he said it will be years, me having some knowledge about orthopedics and being an orthopedic surgeon myself, I took rest for about, I don't say rest, I would say I took rest for about 6 weeks. Then I slowly started walking longer distances, and then I went to start running again in about 3 months. And I was listening to my body basically. The body was allowing me to run. There was no pain, and my foot was slowly improving. I was regaining my muscle strength, and it was allowing me to run. So I started training again, and about 6-7 months later, I think I did my first full marathon. And I'm thankful that I was able to get back to this level. The most important thing is that I don't think we should stop anybody from doing any of their activities. If they're passionate, we should try and help them to get back to their levels. There will be very few instances where you cannot allow them to get back to their pre-injury levels. I'll give you another example. Other than myself, there was another marathon runner, a good friend of mine, who was getting multiple injuries because of his pace and his running continuously. So what he was advised was that you reduce your pace. From trying to run fast, you reduce your pace, and maybe you can increase your distances. So from being a marathon runner, he is now graduated to being an ultra marathon runner. So he runs 50 kilometers, 70 kilometers, 100 kilometers, but at a much slower pace, at 8 kilometers per hour or 9 kilometers per hour, and then he completes all these races. So I think minor modifications in the way you do things, but we should be able to get them back on their feet.
Dr. Satish, after my Vizag marathon last year, I was advised by a doctor to stop running because I started developing some knee pain. Okay, and a very in a very simple manner, what a doctor told us that my body structure doesn't suit for running. I'm a two-legged animal, not a four-legged animal, and asked me to pick up back cycling. Okay, so in such scenario, a person like me, what should we do?
See, if you ask me, most of us, any sports person, will have an injury during their lifetime. It's not that all of us will never be injury free. The point here is to be able to understand what is the cause, what is causing you pain, and rehabilitate you to run again. Now, this two-legged animal versus four-legged animal, if you see, human beings were actually born to run. If you specifically endurance running, so when you're talking of marathons, I'm talking of endurance running. If you take any animal in the animal kingdom and compare it to a human being, no animal can beat us in terms of a marathon distance.
That I agree with you.
So we are not fit, we are not actually born to run speed. There are many animals who can run faster than us, who will sprint faster than us. There are many animals who will run maybe shorter distances, like a horse or a cheetah can run faster than us. But if you're talking of marathon distances, I think we are still the best equipped animals in the world. And if you're talking about how we evolved into this, I think even as a human being, we survived and we evolved because we were able to do endurance running as hunter and gatherer, and then collect our daily food, forage for our daily food, and that's how we survived, and we have become this. So human beings were born for endurance sport.
So I can continue back my running.
You should understand what your knee is doing, why there is pain. Most often there could be an injury which could, some amount of rest and rehabilitation will give you back your strength. Strengthen your muscles, strengthen your body, and do everything gradually. See, you need to be able to achieve your endurance fitness over a period of time. It is not a shortcut. You're not going to have a short-term plan. It is always a long-term plan.
Interesting. So that motivates me and look forward to joining you and with you in NMDC. So that brings a pretty interesting topic. I believe NMDC is 5 months away from now. Now the people who are listening to our podcast, what are the 4 or 5 tips as an orthopedic, as a sports medicine, and a runner who might have run 100 of races? Okay, 5 tips which you would like to give us.
If you're talking specifically in terms of the short
I would be very specific with full marathon.
Full marathon in 5 months time. I think if you have already been running regularly and you're able to do a half marathon comfortably, only then you should think of doing a full marathon in the next 5 months. Is an ideal period of time. About 20 weeks time is good to train yourself and run a full marathon as a race. If you are doing it for the first time, I would suggest that there's no pace goals. There's no point. You should not have any time goals coming up, because this is one of the toughest marathons in the city, in the country. I would say we actually have to go over 4 flyovers.
4 flyovers, yeah.
That's one. So pace yourself. Take your time in achieving your endurance. Number 1. Number 2 is get into a group. Which will motivate you, you will get company, and you will have that camaraderie and that thing which will take you forward in terms of trying to stick to the goal on a long-term basis. I always find that people who run in groups perform much better than people who run on their own. That's number 2. Number 3 is it's all about nutrition and taking care of your body. 1 is you need to eat well and eat right. Number 2 is listen to your body. There is no shame in taking off, resting, and it is important that your body recovers while you rest.
True.
So listen to your body, take off, take rest, and if you're not able to achieve your full marathon this year, doesn't matter. Let's do it next year, but take it as a long-term plan. Number 5 is once you're done, many people get this over enthusiastic about running, and they continue to run and they continue to push themselves. I would say that you need to take sufficient time to recover, rebuild your body, rebuild your nutrition, and then continue doing it again after that.
So when you say continue, you mean the next marathon, or
I mean, see, I don't think anybody who's run a full marathon will stop with one marathon. There is an adage which says that you run the first 30 kilometers in a marathon on your legs, then the next 10 kilometers in your in your head, and the last 1 kilometer in your heart. So you're always cursing when you're reaching the finish line, but as soon as you finish that marathon, you're thinking of what to do next.
Interesting. So, whatever the 5 points what Dr. Satish has mentioned, it's for those people who have done their half marathon and the half marathon people who are planning to go for a full marathon. Am I correct, sir?
Yes, please.
Thank you. Dr. Satish, you mentioned about listening to your body while running. I would like your expert opinion on listening to your body in 3 phases: pre, during the run, and the post run. So what would be your advice on it?
See, when I say listen to your body, I would broadly put it into 2 things. One is the best indicator you have is pain. If there is some pain, that means it is an indirect way of your body telling you to take a step back. The pain, if it is temporary, let's say you had some niggle today and then you went to bed and by morning the niggle is gone, you're fresh, that's fine. You can go on and do it again. But if the pain persists or if the niggle is persisting, then you need to take a step back and understand why this is happening and try to correct. The second is how you feel about yourself, recovery. Rest and recovery are equally important as as much as training in an endurance run. So next day morning, if you're feeling fresh, if you're feeling well recovered, you had a good night's sleep, you had eaten well, all these tie up into how you feel next day morning, then you go ahead and continue to do your practice every day. But the most important thing is, remember that rest is equally important. Your body recovers, the muscles rebuild during rest. During a race, most of us develop, some niggle here or the other. We get a pain here or the other, and we are able to overcome and run. The only thing I would suggest is that you don't have to do your personal best in every race.
True.
A lot of things need to happen and you need to be in the right place at the right time, and a lot of other conditions need to be conducive for us to attain a personal best in every race. So do your best, enjoy the race. There's another adage I like to quote. I don't know who's done this, but the actual race is the training process.
True.
You just go to the race day to collect your medal. That's about it. Yeah. So, and then comes the post run. You need to give it sufficient time. Running a marathon is a big ask. Your body goes through various changes. You can actually measure some of the changes, physiological changes your body goes through in terms of various indicators. So you need to give it sufficient time for it to recover and take care of yourself. You need to correct your dehydration, you need to take care of your nutrition, you need to make sure that your body recovers well, rested well before you continue to race again or to train again. I've known people who've had problems because they didn't take care of themselves. They go into alcohol or they have not had sufficient fluids. So then they develop problems because of these things.
Interesting. So what was your personal best in your marathon?
I have done, I'm a novice when it comes to a marathon. So my best has been 4 hours, 25 minutes.
Oh, that's interesting. That's in fact good. And that was in your New York marathon?
That was in Chicago.
Chicago marathon. How was the terrain and all when you compare with Hyderabad?
So when I've done a few marathons, half and full marathons in India, and then done 2 international marathons. Of the 2 I've done, I liked Chicago the best. The terrain was relatively flat. And you start from the start and finish points are the same, so you get to meet your family, and they're able to meet you in multiple places, and it's very close to where we were staying, so it was actually quite enjoyable. But if you look at, for example, the other one I did in New York, where you had to actually travel for 3 hours before you actually start your run, so and then you from point A to point B, so it was a little tough. I mean, we are used to running as soon as we wake up in India because we almost always train very early in the mornings. We don't wait for the sun to come up, and we don't have breakfast, and then we're used to running on our empty stomachs and taking the nutrition on the way. So these are things which are different. But yes, every race is different. You need to adapt to it and do your best.
What was the best in terms of experience?
I mean, I think my Chicago Marathon was the best because that was my first international. I finished it on my birthday. That fit by 50 didn't happen because of COVID. So I think I could declare that I was fit on my 51st birthday when I did my Chicago Marathon. So that 5 by 51 is something I cherish.
Congratulations. And I also heard that you're preparing for Boston Marathon. When it's likely going to happen?
Boston Marathon is a dream for most endurance runners.
Right.
You do have a charity route, but most of us would like to qualify. So some of the benchmarks in marathon running are doing a sub 4 marathon or qualifying for Boston. So we call it BQ. I think I'm far away from it because I need to reduce my time a fair bit before I can qualify for Boston. But one good thing with endurance running or marathon running is the older you are, the more advantage it is because the qualifying times tend to become longer. And I think in my case, I would look at it maybe another 4 or 5 years from now.
I wish you make it, and we'll again connect and wish you a great luck. Okay. And you never been to Mumbai Marathon?
No, I have not done either Mumbai or Delhi, or maybe the next thing I am looking at is maybe there is something called Chandigarh Fast Marathon. That's in February, so maybe I will do that next year. I'm planning to do that to try and achieve personal best.
Okay. I'll personally recommend you taking a Mumbai Marathon and Vizag Marathon. Vizag for its beauty and Mumbai for the cheering and the passion of the Mumbaikars. Okay, I highly recommend you must take it up.
I heard about the involvement of public in Mumbai, which is phenomenal. I mean, this is something which you see in almost all the international races. But maybe Mumbai sometime in the near future.
Is there any body type that's suitable for running?
For a recreational runner, for somebody like us who runs out of passion and as a hobby, I don't think it really matters. Tall, thin, slim, plump, short, doesn't matter. Let's say if you're tall and you have this ideal cadence, I'm sure you'll be running faster than a shorter guy. But we're all running it for the fun, But there are certain muscle fibers, which are the fast twitch fibers and the slow twitch fibers. In people who have the slow twitch fibers, they are supposed to be more suitable for endurance running, and the fast twitch fibers, they are suitable for shorter distances, the sprints. So yes, body type will matter when you're talking of professional level running or a world championship level running. But for people like us, for doing it as a recreation, I don't think it really matters. Just enjoy for the sake of running. That's about it.
I'm aware that for you to be a good marathon runner, you need to have a buddy. Okay, your buddy is your medal winner. So who is your buddy?
See, end of the day, if one good thing about Mumbai, which you had previously mentioned, is Mumbai gives you 2 medals. I don't know if you're aware of.
Yeah, that's what.
So one is for you to finish, and the other is your inspiration medal. They call it
inspiration buddy. I call it as a buddy medal.
Yeah, but I think a sport like marathon, the inspiration medal or the buddy medal should go to your family.
Okay.
Because you take away so much time and from your family when you're training for a marathon for about 5 months. Every Sunday morning, that's when we do our long runs, practice runs. You're off for about 3-4 hours, and then you come back.
5 hours.
3-4 hours, and you come back tired, and then you are literally not able to take your family out. Your kids are looking forward to spending time with you, and you're sitting there doing massage or foam rolling or whatever. So I think you should always thank your family for allowing you to run, to be able to pursue your passion. So the inspiration should always be your family.
And they also help us to with the proper nutritious food.
Yes, of course.
And the family works for it. Yeah. In fact, NMDC must listen to this, and you must come with a buddy medal. Not a buddy medal, a family medal along with the full marathon runners medal. Okay. And good, that was a very good insight. Dr. Satish, you went about thanking your family for supporting your run. But I also get to see that you have a very strong group, your group which runs together with you, who are your buddies. So can you give us some more information, like what is that group is all about, where do you run, who all are the people, and what's your next marathon plan?
See, like I mentioned before, I think running in a group, actually you perform better. It's been proven that people who run in groups perform better than people who run solo. So we are a big group of around 15 to 20 runners. So even if there are 3-4 people absent on a given day, we have a reasonable sized group which runs together. And we run about 4 days a week, and we all run in and around KBR Park. It helps us in keeping us motivated and taking care of each other. I might be having an injury today. There may be somebody else who's already gone through a similar injury. Then he will give you his insights into how to handle it. So this is actually, it's very useful to run in a group. Yes, on the race day you run by yourself. There is nobody who's going to run with you. You're lucky if you have a buddy who's going to be running at you at the same pace. But on a race day, you would want to do your best, so you will run by yourself. In fact, there are some people who suggest that you practice runs also once in a while, at least, running solo. Coming to the group per se, we are a motley crowd. I don't know, there are a couple of doctors, a few engineers, a few guys from the film industry, from the government service. So the only thing common here is that we're all runners. We all run together. That's the only common thing. Professions and all don't match, and it's actually fun that way, so that you get to not talk shop and you talk about something which is different.
And what about your next run?
The group is actually planning to run in Berlin in September this year. So some of us are participating, some of us are not participating, but usually there's a good crowd, about 10-12 of us travel together, have fun, do a run and come back.
So running is a very expensive affair, international trip.
I mean, if you're running abroad, yes, it is an expensive affair. But if you're running in India, it is still expensive. You start to think that it is not very expensive. But nowadays, the running shoes, you need to have 3-4 pairs of shoes to run. You need to rotate your shoes. You need to have one for the training, one for the shorter runs, one for the race day. Yeah, it is expensive. But compared to some of the other sports like cycling and swimming, it is still less expensive.
That I agree with you. So you are into cycling as well?
No, I do cycling as a cross training. So whenever we're not running, see, one other important thing with marathon running is you need to be able to cross train.
True.
So I do cross training in terms of cycling, and you also need to do strength training. You don't have to bulk up in terms of muscle, but you need to keep yourself strong. So I do two days of gym, 4 days of run, and 1 day of rest in a week. That's about it.
So now you also mentioned that September you have Berlin Marathon. So let's say 5 months later, we're going to have an NMDC Marathon. So how are you preparing for it? Like, because you are already a runner, I'm sure that you don't stop preparing. Okay. So what are you doing for preparing both the marathons?
I'm not really sure what I'm going to do, but I'll do either one of them. But if I'm going to do, I will do only one of them. Yes, there are people who have done back-to-back marathons in a week's gap also. There are plenty of guys who do, for example, the Boston and the London back-to-back. It's only 6 days gap in between these two every year. But I think keeping in view of my profession and my other activities which I need to do, I will not be in a position to recover that fast.
Now my question is that how do you prepare? Like, how do you break running, cycling, strengthening? How do you actually plan your schedule?
So my schedule when I'm training for a marathon is like this. Cycling is usually indoor. So let's say I run on every Tuesday, Thursday, Saturday and Sunday. Sunday is usually my long run days, my practicing long run days. And Monday is my rest day. So Wednesday and Friday I'm in the gym. I do about 30 minutes of cycling in the gym. And then an hour and a quarter of strength training. Various upper body, lower body, various muscles are strengthened, and so that will be my mix. 2 days of strength and 1 day of rest and 4 days of running.
Interesting. Strength, running, and cycling together, all three mix. Dr. Satish, now this particular round we call it as a myth versus fact, and that's more to do with the bone health. Okay, so my first question to you would be, Does running destroy knee?
No, it doesn't.
So can you explain?
See, it has been proven that people or runners have less incidence of osteoarthritis or the age-related wear and tear of the joint when compared to non-runners. The reason being that you have a regular runner is maintaining good physique, maintaining an optimal weight, and is strengthening his muscles and ligaments. So his knee joint is much more efficiently being used than a person who is sedentary, where he has not been using his knee, he's maybe gaining weight, maybe his muscles are not that strong. So it's been conclusively proven that osteoarthritis is not higher among marathon runners.
Interesting. Marathon runners have stronger bones than non-runners.
Yes, not only marathon, any bone strength to improve, any sport which is weight bearing, that means you're pounding your body to a certain extent, improves bone strength.
Okay.
That is required. So, walking or running are actually very good exercises for improving your bone strength.
Okay, walking and running both together. And my last question to you would be, too much of running, does it weaken the bone?
No, too much of running will not weaken the bone. Trying to scale up too fast can lead to injuries. So, like I keep saying, that if you want to run a marathon, it is an year-long program. So, don't scale up too fast, take it slow, you'll be all right.
A lot of people, when you cross your 45, 50, they say, even including the doctors say that don't run, it weakens your knee. Is it a myth or fact?
I think it's a myth. I don't think there is any age limit to running. I started running after the age of 45.
Yeah, you did mention that.
So if your knees are already bad and if they're destroyed, then you may not be able to run. But you also see at the same time there are patients who've had their knee replacements done and they're still running a full marathon.
Interesting. Okay, that I didn't know about it. Then my final question, cycling and swimming are just as good as running for your bone health?
Cycling and running are less, but it is better than being sedentary, isn't it? So because you're not actually putting your weight on, your body is not feeling the same kind of weight when you run. In cycling, you rest on your buttocks and then you're actually, your lower limbs work harder than the rest of your body. And in swimming, because of buoyancy, your body is working less. But compared to a sedentary person, they are better. You are exercising. So I would say cycling and swimming are better than being sedentary. I would say running is better than cycling and swimming.
According to you, what is the biggest myth when it comes to running and bone health?
The biggest myth is that marathon running destroys your knees. It's not true.
We had an interesting conversation so far. You went about picking up running for being fit. So my next question to you is that, what is the linkage of longevity and running? Do you think there's any link between it?
Yeah, I'm sure running has shown or proven to improve your longevity. So we are talking of an increase in your lifespan. But more important to me, I would say an increase in your health span. So having healthier years at the end of your life is, I think, a very important metrics for me personally. So other than a lifespan, we're talking of a health span. So how does running help you do that? I think it's pretty clear that cardiovascular health is definitely improved. So with that, your metabolic health improves, your blood sugars and things are under control. Then this running has shown to improve your brain health in terms of the neurotransmitters which are being produced. And then it is also shown to slow down aging to a certain extent and improve your musculoskeletal strength. So I think these are the 5 important benefits of running, which will help in longevity. The only thing I would say is, in people who are beyond 50, give sufficient importance to recovery, because it slightly is longer. The older you are, the more time you take to recover. So give importance to recovery. And I think the benefits of running in terms of longevity are there.
Yeah. Yeah, we have seen great example like Mikha Singh. And also I have come across a lot of studies which says that normal life expectancy increases from 3 to 12 years. I'm sure we need to do some deep dive and pick out such studies. But what I really liked about the one statement you mentioned is the rather than looking at lifespan, let's look it into health span.
Yes.
That's an important insight. Thank you. Dr. Satish, we have been discussing so far running is good and we all know. But still, there are set of people who should not run. According to you, who are those set of people whom you suggest not taking up running?
See, if you've already been suffering from bad arthritis, your joints are already worn out, then I think it becomes difficult for you to run, because they're not going to be able to cooperate with you. Other than that, people who already have systemic problems, like cardiovascular issues or renal issues, because you need to be having a reasonable amount of body balance to be able to go through this kind of marathon running. But for people who've had cardiovascular issues and who've been treated, every year in NMDC alone, you can also see there's a set of patients who have been treated for cardiovascular problems and they run.
Yeah.
So it's a matter of fine tuning your body, doing it under guidance, and doing it for the sake of fitness. Then I think anybody should be able to run. So why do you want to run a marathon? Doing a 5K every day or every alternate day is good to keep you fit. So I think you need to have a certain sort of a goal in mind and then decide what you're doing it for. If you're doing it for the sake of fitness and enjoyment, 5K is good. It gets over in about 35-40 minutes, and then anybody should be able to do that. So I wouldn't say there is a clear-cut no to anybody, but you need to be able to have a goal in mind.
Yeah.
What is the reason you're doing it for? Not a goal, what is the reason you're doing it for? So that I think is important.
What I understood is running is not marathon.
Yes.
Anyone can pick up running.
Yes.
It could be 3 miles, it could be a full marathon. And the people whom you mentioned, they should be cautious about taking up
Doing it under guidance.
Okay, sure. Now, what are the common exercise which you recommend for a strong bone health?
See, bones react to stress.
Okay.
So any exercise which applies stress to the bone is good for it. So for that, you need to have weight bearing, meaning your body weight at least should be on the bones to stress them out so that they react to that. So walking, running, any of these are good for bone health. In case you're not able to do anything, even resistance bands, using resistance bands to exercise, which will activate your muscles better, and this will indirectly cause stress on your bone, is good for you. So any resistance exercise or weight bearing exercise are good for bone health.
Interesting. Dr. Satish, what is your recommendation, a good nutrition for good bone health?
So I think there is no need for us to have a separate nutrition for bone health. Yes, you do need to get sufficient amount of calcium into the body and vitamin D3. And if you look at many of our females, especially after menopause, suffer from severe osteoporosis. That is because of poor intake of calcium. That being the basic premise of bone health. And in general, if you're a runner, you need to look at getting in about 1.5 grams of protein per kg body weight per day, along with lower amount of carbs and fats. So the emphasis is on protein, and sugars are something which you would like to avoid. But I cannot sufficiently emphasize that specifically for women, postmenopausal, sufficient intake of calcium and exposure to sunlight and keeping their vitamin D3 levels under normal levels is extremely important.
Dr. Satish, my next question is, how marathon running helped you to be a better person professionally and personally?
See, I find after running marathons that I somehow seem to end up with more energy. I finish my run and I continue to go for work, and I'm able to concentrate better, and I have more energy left in me to continue for the rest of the day. It has helped me in improving my focus, and it has helped me in improving my confidence. Now I have the confidence that if I set my heart out at achieving something, I will be able to achieve it. I think because marathon running is one of the few sports which, let's say less than 1% of the population in the world has completed a marathon so far. So that's some level of
That's a
achievement.
pride
That is some level of achievement that's given us a sense of pride and allows us to do things.
And does it also help you to, with respect to your peer relation?
See, peer relation in terms of that, we seem to be a happy bunch. That much I can say.
Agreed.
Most runners together, when they meet, they're all a lot of positive energy is something which you can feel all around. So yes, that helps me in relaxing at the end of the day, and my day starts off with a good laugh. So I think that's something which is very helpful.
The success behind Dr. Satish clinical practice is marathon running.
Yeah, my friends make fun of me by saying that if you go to him for all ailments, his answer is to run.
Interesting. Well, thank you very much, Dr. Satish, for inspiring many of us, and especially me. And as I mentioned you that I look forward to running with you for upcoming Hyderabad Marathon, and personal invite from mine, I'll register for you for Mumbai Marathon, and it's indeed a beautiful marathon. Thank you very much for your insight, what you have shared, being very candid, and I wish you that soon you prepare for Boston Marathon. Okay, and thank you very much again.
Thank you, Vishy, and it's always a pleasure to meet you and interact with you. And I hope we get many more such opportunities.
Sure. Thank you, sir.